Welcome back to SDSU. We are so excited to be able to have you on campus for in-person courses and activities. This video provides information on Fall 2021 COVID-19 infection prevention and policies. It is important for members of our community to understand these guidelines and policies so that we can all have a healthier and safer semester. Additionally, we want you to avoid the outcomes of violating COVID-19 policies, which can range from a warning to suspension. Once we discuss the policies, we will share some of the exciting opportunities we have planned for students to come together safely on campus this fall. Next, we will review the vaccination policy. As the California State University announced, the COVID-19 vaccine is required for all students, staff, faculty, and visitors who will be physically on campus this fall semester. Whether you're on campus for classes, work, research, events, or student organization activities, you need to have a COVID-19 vaccine on file with SDSU. This requirement is not contingent on the full U.S. Food and Drug Administration, FDA, approval. Students must upload proof of vaccination to Healthy Connect, the university's secure online health portal, prior to Monday, August 16th. The upload process takes less than 10 minutes, and again, if you plan to be on campus or at an SDSU facility at any point this semester, you must be vaccinated. The CSU COVID-19 vaccination requirement allows for students, faculty, and staff to seek an exemption based on medical or religious grounds. Exemption requests for students and staff and faculty must be submitted before August 16th. If an individual is in the process of being vaccinated but will not be fully vaccinated by August 20th, the first official day of fall semester, they can complete a temporary waiver request. This will place the individual on a weekly testing program until they reach fully vaccinated status. Please note, an individual is fully vaccinated 2 weeks after their second dose of a 2-shot vaccine, or 2 weeks after the first dose of a single-shot vaccine. Students who are not vaccinated will also be required to complete a daily health screening. It is also important that you follow the university's updated facial covering policy, which provides direction for those who are vaccinated and for those who are unvaccinated. Please pay close attention to the policy and refer to it based on your vaccination status. For those that are not vaccinated but have an approved medical or religious exemption on file with the university, facial coverings must be worn at all times while indoors, when in instructional settings, whether indoors or outdoors when unable to maintain 6 feet of distance from others. Certain limited exemptions to wearing a facial covering will be granted to unvaccinated individuals, which are outlined in the full policy online. For individuals that are fully vaccinated, facial coverings are required in the following settings: whenever students are indoors, when in instructional settings, whether indoors or outdoors, and this includes classrooms, instructional labs, spaces being actively used in an instructional capacity, and the university libraries. It is also important to note that vaccinated instructional faculty, teaching assistants, and interpreters can remove their facial coverings when teaching, as long as all students are masked in the classroom. Your health and safety, and that of all others on campus, is our #1 priority. It should be your #1 priority as well. Students who are experiencing symptoms of any sort of illness should refrain from coming to campus or from leaving their room if living in a residential hall for any reason other than to seek medical care or a COVID test. For your own health and your fellow SDSU community, we advise that you please stay home or go home if you begin experiencing any symptoms of illness, regardless of severity. This new norm is being communicated to faculty, staff, and students. You should feel empowered to work directly with your professors, directly regarding any missed work or class time. Next, let's quickly review the symptoms associated with COVID-19. It is crucial for everyone to recognize these symptoms. Symptoms include runny nose or congestion, sore throat, fatigue, headache, cough, shortness of breath, difficulty breathing, high fever, chills, body or muscle aches, nausea or vomiting, and a new loss of taste or smell. Symptoms may appear 2 to 14 days after exposure to the virus. An individual with COVID-19 is contagious to others in the 2 days before they develop symptoms and throughout their illness. It is also possible for an individual to be asymptomatic, meaning that they are infected with COVID-19 but do not experience or show any symptoms. Even if a person is asymptomatic, they can still spread the disease to others. While the vaccine is the most effective prevention against the COVID-19 virus, even vaccinated persons can still get the COVID-19 virus though these symptoms are often much more mild than those who have not been vaccinated. Again, you absolutely should not attend classes or spend any time with other people if you're experiencing any COVID-19 symptoms. Stay home or immediately go home if you start to experience symptoms and seek testing right away. If you are experiencing COVID-19 symptoms, get tested. Residence hall students have to get tested within 6 hours of experiencing symptoms, even if they choose to go home. Students living in a residence hall may only leave their room to get tested or to receive medical care. Off-campus students should be tested within 24 hours of experiencing symptoms. Students living in off-campus residence may not come to campus for any reason besides testing or receiving medical care while they have symptoms and are awaiting test results. If your test is negative, do not return to class until at least 24 hours have passed since your last fever and you have an improvement in your symptoms. If your test is positive, you should not return to class until at least 10 days has passed since your first symptoms appeared and there is an improvement in your symptoms, example cough, shortness of breath, and at least 24 hours have passed since your last fever. Again, this is extremely important for preventing the spread of COVID-19. Let's talk about reporting a COVID-19 case. You should also report any positive cases or exposure to the university so that we can offer direct instructions to individuals who are sick or who are in contact with those who tested positive. This is important and must be reported within 2 hours of exposure or receipt of positive test per the SDSU Student Code of Conduct. You must report using the case report form on the university's COVID-19 website at sdsu.edu/COVID-19. If you are unwell, diagnosed with COVID-19, or are quarantining due to exposure to someone who is diagnosed with COVID-19, you must contact your instructors to inform them of your situation. Communication with your instructors is key. Update them on your situation to ensure absences are accounted for and you have clear instructions for making up assignments. Next, let's review COVID-19 testing. Students who have been approved vaccination exemption on file must get tested every 7 days in order to have campus access. Students who have any COVID-like symptoms are also required to get tested. There are a few testing options available for SDSU students. Students can get tested through SDSU Student Health Services, testing kits available from vending machines on campus, or their preferred healthcare provider. The test must be molecular, PCR, RT-PCR, TMA, LAMP, or NAAT test. Antigen and antibody tests will not be accepted. If you are tested at any location other than Student Health Services, you must upload documentation to Healthy Connect. We cannot accept submissions via email. Please ensure your results have your name clearly visible on them. This is also university policy and outlined in the Student Code of Conduct. Students who have tested positive or been knowingly exposed to COVID-19 must notify Student Health Services in a timely manner, within 2 hours after the positive test result. If a residential student tested positive, they will be moved to an isolation unit. Students who are in isolation or quarantine must not attend in-person classes, activities, visit other on-campus facilities, or end isolation until they have completed the CDC's guidelines to discontinue home isolation. Next, let's talk about San Diego State's residential policies. San Diego State University has taken and will continue to take multiple measures to protect residents living in on-campus housing may only have guests in their residential spaces, including personal space and community spaces such as lounges, study rooms, and outdoor recreation areas, who live in on-campus residential communities. The only exception to this is those providing assistance to move the resident into and out of the residential space. Such assistance must comply with all current public health guidelines, including physical distancing and the use of personal protective equipment, and must be limited to the actual time required for move-in or move-out. Next, we will talk about some opportunities to come together. This fall, we will have many exciting opportunities to come together as a campus community. These opportunities include Welcome Weeks events, Aztec Nights events, SDSU Go field trips, trips to SDSU football games in Carson, one SDSU community events, and more. Knowing what to expect in terms of COVID-19 policies is crucial to ensure a safer and enjoyable experience. The university's COVID-19 campus activities policy will be published in a few online locations, including the Center for Student Organizations and Activities website. The COVID-19 Campus Activities Policy will be responsive to the evolving needs of our campus community during the COVID-19 pandemic and is subject to change. Some programs, such as Aztecs Nights, may also have policies for their events. A few highlighted expectations for the beginning of the fall 2021 term include: each attendee must be approved to access campus in order to participate in activities, whether it is on campus or off. Students should be prepared to show their campus clearance indicator through Healthy Connect upon event entry. Event attendees may not come to the event if they have any signs of illness, whether COVID-19 related or otherwise, or if they are currently under an order to isolate or quarantine. All attendees will be required to wear facial coverings at times in accordance with the university's facial covering policy. Non-SDSU student guests will not be permitted to attend Aztec Nights events. All students must abide by published COVID-19 policies at events on campus, all programs hosted by campus departments, and all activities facilitated by recognized student organizations in order to avoid consequences such as cancellation of activities and disciplinary consequences. Thank you for taking the important steps to help prevent the spread of COVID-19. You can stay up to date on the latest information through the SDSU COVID-19 Weekly Digest, which is sent to your SDSU email address. For more information, visit our website, sdsu.edu/COVID-19. If you have any COVID-19 related questions or concerns, email covidclearance@sdsu.edu. Now it's time to test your knowledge. You can take this quiz in order to reinforce what you've learned during this training, or indicate the completion of this training if you are doing so as a requirement.